COVID-19 vaccines are rolling out in the Cheyenne River Sioux Reservation. Here in the main town, the Tribal Health Center, run by Native American authorities, vaccinates residents.
All done.
Nearly a third of the reservation's population has been vaccinated, way above the national average. The trick? Not waiting for people to come for the vaccine, but taking the vaccine to the people. And that means a long drive. This is the fourth largest Native American reservation in the US, and people here live in some remote corners, says Field Health Director of Nursing, DANETTE, SERR.
It's miles upon miles to get anywhere from here. I mean, you're basically in the middle of nowhere.
The trips can last hours, sometimes never seeing another car. Always bring a spare tire, water and food, because if you break down, there's not much out here, including cell phone reception.
We're here in the middle of the Cheyenne River Sioux Reservation. We're next to this highway, and it's along this road a medical team is going to come to deliver vaccines to those who most need it. But just to show you how challenging it is to get these vaccines to the most remotest areas of this reservation, as far as one looks, there's not a single building to be seen.
Today they've come to the tiny town of Whitehorse. According to the latest census data, just 141 people live here. There are few jobs, and 60% of the families live below the poverty line. A small tribal clinic serves the town and those who live nearby. The remoteness is not the only challenge.
People have been very reluctant to get the vaccine, mainly because of how fast it was produced, basically, or what people are telling us. It was too quick. And even with education, we are getting people to come around to getting the vaccines, but there's still that reluctancy to get it.
There are long memories here of outsiders bringing diseases that have devastated Native American populations. Sometimes, they suspect, on purpose. Suspicions linger of a new injection freely provided by the government. The health workers say more education is key to convincing the holdouts. Today, they would like to see more than 3 people vaccinated at Whitehorse. But every vaccination counts. Molly's mother fell sick with COVID-19 in October. Medical facilities on the reservation are not equipped to treat very sick coronavirus patients, so she was transferred to a hospital hours away.
One of the hardest things for us is her being in the hospital and us not being able to be there at bedside with her and only being able to communicate through FaceTime.
She died a month later. Andrew is here for his vaccine.
My brother Roger, he's scared to get it. My son Andrew, he lives up in Bismarck, and he said he don't want to get it.
Why? What do they say? What do they say why they don't want to get the vaccine?
They're scared.
Did they say of what?
They're scared they're going to die.
His partner Alma is next. If the field teams didn't bring the vaccines out, she says, many people would be unable to travel and so wouldn't get vaccinated.
I think it would be very, very difficult because a lot of the people in the communities do not have transportation.
They finished in Whitehorse for the day. Somewhere else and far away, more wait for their vaccines, and the team has promises to keep, and many miles to go before they can sleep. TOBY MUSE reporting for CGTN, the Cheyenne River Sioux Reservation, South Dakota.